Our culture is ingrained with a quick fix mentality for everything, including weight loss, and within diet culture, the ketogenic diet is amongst the most popular. In this presentation, we are going to talk about the history of the keto diet, its extensive use for epilepsy treatment in the early 1900s, the physiological stages our body goes through to reach ketosis, and discuss faulty logic within the fad diet. In the history of the ketogenic diet, there are three distinct eras: 1921 and before, 1921 to 1993, and finally 1994 to the present. Before 1921, epilepsy in children was treated by fasting for extended periods of time. In the 1920s, the ketogenic diet was born and used as the preferred treatment until drug therapy took over. The ketogenic diet was then shelved by the late 1930s and rarely used, and for the next 6 decades, its use was minimal. Finally, in the last few decades since 1994, the ketogenic diet has made a resurgence in the clinical settings and exploded on the scene as a fad diet. In the early 20th century, 2 French physicians published their success of minimizing epileptic symptoms by starving children who had epilepsy. This was the first report to create the conversation of how starving could affect the symptoms of epilepsy. Around the same time, Bernard McFadden, a fitness guru, used starvation for a period of 3 days to 3 weeks to cure diseases such as asthma, diabetes, and epilepsy. McFadden's rationale was that the energy required to digest food would be available to fight and recover from disease. Shortly after, Dr. Conklin, an assistant to McFadden, adopted the fasting method to treat epilepsy, which drew attention of an endocrinologist, Royle Galen. Dr. Galen then conducted a clinical study of fasting children to treat epileptic symptoms. The results were reported to the American Medical Association, presenting fasting of 20 days as a treatment for epilepsy. Soon after, Dr. Wilder coined the term ketogenic diet. Moving into 1921, the term ketosis started to develop when Woodyard noticed ketones in a state of starvation or with a very low carbohydrate to high fat ratio in individuals he was working with. Concurrently, Dr. Wilder coined the term ketogenic diet by proposing a diet very low in carbohydrates and high in fats could be used to provoke the formation of ketones. The great thing about Dr. Wilder's realization is that using the keto diet for treatment would be more effective than starving because treatment with the diet can last longer than without. It was not until 1925 that Peterman quantified each of the macronutrients for children to 1 gram of protein per kilogram of body weight, 10 to 15 grams of carbohydrates, and approximately 90% of the calories from fat. The ketogenic diet was then widely accepted as the treatment for epilepsy through the 1930s until an epileptic drug was discovered in 1938. From the late 1930s into the early 1990s, drug therapy replaced the ketogenic diet for treatment. In 1994, keto resurged when Talk About the Diet aired nationally on NBC TV's Dateline. Shortly after that, celebrities started to promote the diet culture by boasting its effects of weight loss. Heading into 2013, keto was promoted by the scientists at Gladstone Institute in San Francisco by linking beta-hydroxybutyrate, a ketone body, to activate antioxidant and anti-inflammatory genes. Shortly after, in 2017, when podcasts were gaining popularity, a podcast about the keto diet with Tim Ferriss and Joe Rogan went viral.
The key aspect of the ketogenic diet involves the restriction of carbohydrates. This restriction no longer provides adequate glucose to provide for the body's metabolic and energy needs. Once exogenous carbohydrates and stored glycogen become depleted, the Krebs cycle and electron transport chain become underutilized, and our body switches gears. Simultaneously, beta oxidation and gluconeogenesis are stimulated in response to an event of low blood glucose. Gluconeogenesis increases production to supply red blood cells, cells in the eye, and a portion of the brain, as well as prevent hypoglycemia. However, this process is inefficient and unable to provide the rest of the body with a proper supply of glucose. Concurrently, beta oxidation is supplying an abundance of acetyl-CoA in an effort to maintain the Krebs cycle and electron transport chain output of ATP. But because there is a reduction in oxaloacetate for gluconeogenesis, less oxaloacetate is available for the Krebs cycle to produce citrate. Our bodies recognize this and make a final shift and send acetyl-CoA into another pathway, ketogenesis. The excessive amounts of acetyl-CoA are shuttled into this new pathway, ketogenesis, to form ketone bodies. Acetyl-CoA is combined with another acetyl-CoA to form acetyl-CoA that goes on to be converted into HMG-CoA and finally converts into a ketone body, acetoacetate, that can now enter the blood for circulation. Acetoacetate in the liver can also be converted into two other ketone bodies, acetone or beta-hydroxybutyrate. Acetoacetate and beta-hydroxybutyrate are two ketone bodies used for energy. One main reason why ketogenesis is critical during low glucose levels is that the brain is unable to use fatty acids due to the inability to cross the blood-brain barrier. However, ketones are. The ketone bodies provide energy for extrahepatic tissues, particularly in the brain, skeletal muscles, and cardiac muscle. Once ketones enter tissue throughout the body, they convert back into acetyl-CoA, which produces two acetyl-CoA molecules that are available for the Krebs cycle. With the Krebs cycle functioning, the electron transport chain can produce ATP and energy levels increase.
Currently, there are no international guidelines that exist for the ketogenic diet, and it largely survives in the vortex of social media. This makes it difficult for the general public to find accurate information due to a variety of interpreted information and unreliable sources, often giving an impression that it entails following a high-protein diet. However, a ketogenic diet proposes adequate protein between 1.2 and 2 grams per kg, 10 to 50 grams of carbohydrates, and approximately 90% of calories from fat. As the ketogenic diet fad has increased in popularity, a percentage of adopters have interpreted according to their understanding. There are necessary things to consider. The difficulty of consuming the required carbohydrates between 10 to 50 grams is the breaking point for most, and even the slightest increase halts the ketogenic process, with the desired benefits of the diet not being achieved. Next, if a follower interprets that the diet is considered high protein at the expense of fat, then the conversion of excess amino acids to glucose would not keep the body in ketosis, additionally reducing the desired benefits. Lastly, due to the restriction of carbohydrates, eliminating a substantial amount of fruits and vegetables, the diet inherently lacks recommended fiber and certain nutrients that may lead to nutritional deficiency in individuals. Following the ketogenic diet for a very long time, an excess of acetyl-CoA availability occurs, resulting in the production of three ketones. Acetone results from acetoacetate and due to its high vapor pressure crosses the membrane barrier into the alveoli of the lung and the airway. As a result, acetone is normally present in the breath. Breath acetone is considered a reliable biomarker of ketosis in adults consuming ketogenic meals. Acetoacetate and beta-hydroxybutyrate have a very low pH and donate protons into the bloodstream, raising blood acidity levels. And if unregulated over time, ketoacidosis, a very dangerous condition, occurs. Some of the signs and symptoms experienced by an individual as a result of ketoacidosis could be dehydration, which is the most common early onset complication and can lead to urinary excretion of ketone bodies and imbalances in micronutrients. As the body switches from burning carbohydrates to burning fat for energy, it leads to lethargy. Lethargy could also be due to excessive ketosis and nutrient deficiencies. As mentioned earlier, increase in acetone levels would lead to halitosis. Other complications are hypoproteinemia, which occurs due to gluconeogenic consumption and restriction of carbohydrates, and gastrointestinal side effects. GI disturbances are due to not being able to tolerate the diet and may even reduce the effectiveness of the diet. Diarrhea is the main sign of intolerance or malabsorption of fat. The high lipid content of the ketogenic diet prolongs gastric emptying and also promotes GERD. A decrease of fiber or decreased volume of food may also lead to constipation. In conclusion, a ketogenic diet can bring about the desired results if strictly followed and is more successful when implemented by a professional. As mentioned earlier, this diet is extremely difficult and a giant barrier for the general public to adhere to. Its popularity exploded due to an immediate weight loss gratification, but is largely a result of water loss from glycogen depletion. Moreover, when someone follows a ketogenic diet and deviates even slightly, they may gain not only the initial weight loss but even more. It is recommended that if someone decides they want to try a ketogenic diet, to do so under the supervision of a professional.